Hi, I'm Kimberly Trion, and I'm going to demonstrate a central line dressing change. I have no jewelry, my nails are clean and bare, and my hair is up. I'm going to start by verifying my physician's orders. I'm going to gather my supplies, enter my patient's room, close the door or curtain for privacy, perform hand hygiene. Hi, sir, I'm Kim. I'll be your nurse today. Can you verify your full name and date of birth? Verify 2 patient identifiers. Okay, Mr. Smith, today we're going to change your central line dressing. Is that okay? All right, so the first thing that we'll do is we will put a mask on, and we will ask our patient to put a mask on or turn their head away from the procedure site, as well as anyone who is in the room or at least the vicinity of our procedure to maintain our asepsis. We'll perform our hand hygiene and put on our clean gloves. All right, and then real quick, I'm going to palpate just around the insertion site. We're looking for any pain on palpation or tenderness, as well as any signs of maybe some fluid, some sub-Q fluid. So then we're going to pull up our dressing, stabilizing it with our non-dominant hand, and we're going to pull up each corner of the old dressing parallel to the skin. And then we'll be sure to pull it away from the insertion site so that we don't pull out our catheter. And we will discard our old dressing. Next, we're going to inspect our insertion site. We're looking for any redness, drainage, swelling, discharge, or just general signs of infection. We're going to inspect the skin around. Again, looking for any redness, swelling, rashes that might have developed. We're going to inspect our catheter, make sure there's no kinks, it doesn't appear dislodged. And then we will remove our gloves and perform hand hygiene again. And then we will open up our new catheter kit, pull out our sterile gloves, and then only touching that 1-inch border, open them up. Start with our non-dominant hand. And our dominant hand. Okay, next from our kit, we are going to take out our gauze and our chlorhexidine. Since we have chlorhexidine, we're going to make sure that we crack it and then give it a second for the solution to fully saturate the sponge. Also, because it's chlorhexidine, we're going to use friction in a back to forth motion for at least 30 seconds. If we were to use alcohol, we would do in a circular motion from the inside out. So we will grab our catheter with our gauze and do our friction. We want to ensure that we are cleaning the same size as the dressing. And then we're going to make sure that we do our tubing on the top and the bottom. We're going to allow this to dry completely without any fanning or blowing on it. Once it's completely dry, we're going to grab our new dressing. And we're going to place that over the insertion site, trying to limit any bubbles or wrinkles as best as we can. And then we're going to remove our border. And then on the label on the border, we are going to initial date and time. our dressing change. And we will place that on the edge of our new dressing. All right, from there we're going to discard our supplies. We're going to remove our gloves, remove our masks. All right, we're going to place our patient in a position of comfort, ensure the bed is low and locked with a collate in reach. We'll perform our hand hygiene and document our procedure.